Surgical journey for a patient is when they come to the clinic here, when they're checked in, when they're seen by a nurse, when they see me, when they're seen by the advanced practice physiotherapist, when they come to the hospital for their pre-op visit and see another nurse, and a care team to have their blood work drawn. And all those people are very supportive of the program. They say, oh, you're having hip surgery, it's fantastic, you can go home in a day.
Yep.
When you come to the pre-op area and you're seen by a nurse and the anesthetist, like, everyone's sort of excited for you and excited for you to be here. And patients are always telling me how they felt so welcomed and supported by the staff here and how friendly they were. And I think that often in these dark days of healthcare, we lose the empathy when we deal with people. And I think if you can keep that, it makes the patient journey so much better. In medical school at the University of Western Ontario, I think people tend to gravitate towards either surgical or non-surgical specialties. Like, do you like working with your hands? Do you see a degree of technical, are you inspired by that kind of work? And so I liked the idea of surgery. I like the idea of, fine motor skills and stuff like that. I like the idea of being able to have a bit of a different day every day, not just sort of sitting in an office and seeing people. Then when I was exposed to different surgeries, orthopedic surgery is, it's really a privilege. It's something where the two main types of patients that I operate on, people that break their bones that need to be fixed, and people that have arthritis that need hip and knee replacements, in general are very thankful, and you could see the impact you made in their lives. You take somebody that's broken a hip and can't walk, and you're able to do surgery and allow that person to walk again, is very gratifying to know that your work has an impact. That in Toronto, in our region, we were the first hospital to start it, but since then there's a number of hospitals that offer the same surgery. I think in fact most hospitals now in the GTA have at least one surgeon that's either doing or learning anterior hip replacement, except for one or two hospitals. So it's definitely spread to the fact that now I've organized a group called the Toronto Anterior Hip Group, and we meet every 3 or 4 months to discuss the learning of this procedure, difficulties that people have had during their learning curve, and share insights in a sort of informal manner just among surgeons. So that's what helped foster sort of a network of people sort of interested in the procedure, sharing ideas how to pressure their administration to help support them as they learn a new technique, as they look for tables, etc. So I think that at least right now there's been a huge explosion of anterior hip surgeons in Toronto and in Canada in general.